Hi, this is Dr. Jay with Team Healthcare Clinic. I wanted to tell you about our approach. We got all of our providers together a number of years ago and said, what are all of the necessary steps to have patients have success with their knee pain treatment? And then we divided it up and sort of conquered in terms of how we put attention on different areas. So let me go through the 5 areas. One is improving circulation. A second is increasing the cell healing. Another is increasing lubrication for the knee. The fourth one is going to be biomechanics, and then the fifth one is reducing inflammation. So that's just kind of the overview. Improving circulation would be things like acupuncture and massage, so that we can increase blood flow to the region, especially with old chronic problems. That can be very useful. The maximized cell healing is dealing with things like PRP, which stands for platelet-rich plasma. It could also be things like lasers, which increase the ability to heal, A2M, and umbilical cord tissue. Some of those, the PRP, the A2M, and the umbilical cord tissue, are all regenerative medicine type products that can help enhance healing. The next category is lubrication, and that's like the viscosupplementation, also called rooster comb. That's the injectable that helps lubricate the joint. It doesn't help it to heal like, say, PRP or A2M or umbilical cord tissue, but it does make the joint more lubricated, especially for a degenerative osteoarthritic knee. The category of biomechanics is something we do, I think, very well with. There's basically 3 components to it. One is physical therapy, another is chiropractic care, and then a third is an unloading type of brace. Physical therapy is probably kind of obvious, where we're looking at the whole kinetic chain, which is the foot, the ankle, the knee, the hip, the back, and how they all must do their job in order for the knee to work properly. And that's similar to what the chiropractor would do, only obviously a physical therapist is going to do it more from a musculoskeletal, muscular, and the, excuse me, the chiropractor more from a skeletal or bony alignment. Then there's the unloading brace. We are a DME clinic, which stands for Durable Medical Equipment. Insurances, especially like Medicare and others, but will pay for qualified people to have a brace that allows them to be able to maybe walk distances they weren't able to, or stand longer, because it has an ability to unload the knee. And by that I mean take pressure off from the more degenerative side of the knee. So it works really well from a biomechanical standpoint to allow people to be able to walk and do things that they weren't doing before. And then the final category is inflammation. We do labs a lot of times looking for inflammatory markers and other causes, but we also add in nutrient therapy, whether it be glucosamine, resveratrol, turmeric, glutathione, whatever it seems like that individual person needs. So if we look at those 5 categories, improve circulation, increasing healing, lubrication, biomechanics, and inflammation, we have done, in our opinion, the best, most thorough approach we can take that we know of to help somebody recover without having to go to a drug or certainly to surgery. So if you're interested in that, let us know, and we'll see which categories you might be deficient in and how you can be best helped.